if you look into our muscles that are used in breathing, we're going to start with the diaphragm. The diaphragm can be seen as this little bit of muscle because he's sticking out just below the lungs. So this is the diaphragm. It's going to separate the thoracic cavity from the abdominal pelvic cavity. So it's right here deep underneath the lungs. Now with the diaphragm, we look at the origin, the insertion, as well as the innervation. So where does it originate from? The diaphragm is coming off of the inferior internal surface of the rib cage. So the inferior internal surface, we're talking if it was in the bottom here, right where these attach, if the ribs were back in place. We also have some origins coming from the sternum, as well as the costal cartilage of the last 6 ribs. So the ribs we have would be coming right around up front here. Remember, the ribs cage would be blocking the front view. Now there are also some origins of the diaphragm coming from the lumbar vertebrae. All these origins are going to insert into the central tendon. So that central tendon right in the middle of the diaphragm there. The action, well, what does the diaphragm do? The main action is going to be inspiration. When the diaphragm contracts, it flattens out. By flattening out, it increases the volume inside the lungs. This allows air to flow in. So you're taking a breath, you're breathing in. So the action of the diaphragm, at least the main action, is inspiration. The innervation, or the nerve that is going to control it. The innervation is the phrenic nerve. Now there are 2 other muscles that will aid in breathing. But to see those, we're going to have to put the actual ribs back together. Now with the ribs back on, so we have the entire body back intact, we're looking at the external and internal intercostals. If you look in between the ribs, these muscles are going to be your intercostal muscles. If we look right at this one right here, this would be an internal intercostal, while this one is the external intercostal. The reason you can tell the difference is the fiber direction. Look at the fibers of the external intercostal. They're heading down towards the center, just like the external obliques. So think about the whole hands in pocket, the fiber direction. While the internal intercostals, the fibers are running up towards the middle. So this is the direction of the internal intercostals. This is going to be the direction of the external intercostals. Now as far as actions go, these external intercostals, they're going to allow for the ribs to move. Precisely, the external intercostals are going to pull ribs towards one another to elevate the rib cage. What that means is this external intercostal will pull this second rib up. This one pulls the third rib up. This one pulls the fourth rib. Long story short, that textbook definition of elevating the ribs is basically helping with a deep inspiration. Take a deep breath. What happens when you take a deep breath? Your rib cage gets larger. Those are the external intercostals helping out. Now these internal intercostals, well, the internal intercostals are drawing the ribs together and depress the rib cage. Well, if you're drawing the ribs together, they're getting closer, which means forced exhalation, or you're breathing out. So if you take that deep breath in, you're using the external intercostals with the diaphragm, and then you blow it all out. That's the internal intercostals helping to compress the ribs back down. So you have your internal intercostals and your external intercostals. They both can aid in breathing.